Dr. Joe Jabre. I'm a neurologist and I specialize in EMG. I'm here at Neurosoft, Brazil, demonstrating the technique of concentric macro-EMG. Concentric macro-EMG is a technique that allows you to record both a concentric motor unit potential and a macro-EMG potential. So let me be a little bit more clear about what I mean by this. If you look at this slide here, you can see the picture of a concentric electrode inside the muscle. And these small white dots here represents the muscle fibers of one motor unit. They are scattered inside the muscle, of course. So basically, if you look at the needle electrode inside the muscle, you can immediately see that the amplitude of the concentric action potential here is determined by probably 2 or 3 muscle fibers that are closest to it. Then, if you look at the spike right here, the spike is contributed to by maybe 5 muscle fibers. And the area is contributed to by maybe 20, 25, or 30 muscle fibers that are closest to the needle electrode. Now, the duration really records from the majority of muscle fibers in the needle electrode, but it's hard to measure usually, and not everybody agrees on how to measure it. Macro-EMG can record from the majority of muscle fibers in the muscle. So that's why it's useful to study macro-EMG when you really don't have a good idea of how big the motor unit is, because the concentric can only tell you about the 10 or 15 muscle fibers of the motor unit only. And for instance, in the first dorsal interosseous muscle here, there are about 300 motor units, okay? And so when we're only looking at 10 or 15 muscle fibers of that motor unit, we really don't have a good idea of its size. So how do we do macro-EMG? First of all, let me show you a little bit about how we do concentric EMG. And this is a concentric EMG electrode. And basically it has a core inside of it, so it's a wire inside of it. And it's about 150 micron, and it has the cannula. So with concentric EMG, we are recording the core to cannula potential, and you get a potential that looks like this. With macro-EMG, we want to record the activity that the cannula sees and reference it to a surface electrode nearby. So let me show you a little bit about how we're positioning this. So right now, basically, we're going to be using 2 channels of the EMG machine to do this. In this particular technique, we are using the Neurosoft NeuroMap Micro unit to do this recording. This is a unit that has 2 channels, which can easily do macro-EMG. It has a special program, which I will show you, that does macro-EMG. So if you look at this picture here, you can see the concentric needle that has the core wire inside of that. And the wire is going to be recording the motor unit potential as reference to the cannula. So here in channel 1, you see the concentric action potential, which is the core to cannula, and that gives you the concentric potential. Now, in the second channel, we see the macro potential, and the second channel is the cannula as reference to a surface electrode nearby. Now, you will see that the potential, concentric potential, is quite big here, but the macro potential is actually small. So how does that happen? Well, the concentric potential is really very close to the muscle fibers, so it's going to show a very big amplitude, and by big I mean 1 or 2 millivolts. Whereas the macro is as close to every single muscle fiber as it can be, so it's distant from all the muscle fibers, and so it's recording the activity of the entire motor unit. So the potential looks small, but it's actually not small, but it looks smaller. So what we do when we record the muscle, the concentric macro potential, what we do is we find a good concentric motor unit potential, and once we find one, we adjust to trigger on the concentric motor unit potential, and on the second channel here, we see a lot of activity that goes up and down because we see activity from too many muscle fibers. So when we trigger on this concentric action potential, we start averaging the second channel on that, and all of a sudden we see the macro potential appear. So this is now the principle of the concentric macro-EMG. So now what I want to show you is how we position the electrode. So I'm going to take everything out to show you how we set it up. So basically the first thing we do, of course, is to put the ground electrode, which in this case is this right around the patient's arm here, forearm. And then we're going to plug the concentric channel, and the concentric channel plugs in here, which essentially connects the core of this needle here. Where is the needle? And the needle is right here, thank you. So essentially it connects the core wire of the needle to the black input and connects the cannula of the needle to the red input. So when you plug this in here, the core is connected to the black and the cannula is connected to the red. So now we're going to use a bridge to look at channel 2, and I will explain what that means. So basically in channel 1 we have core to cannula, but in channel 2 we want cannula to surface. Cannula would be active and surface will be reference. So how do we get the cannula to channel 2? So basically the cannula here, as I said in channel 1, is coming from the reference. So I plug in here and I use a bridge. This is a bridge, which is a wire that goes from one input area to another input. So I put the cannula here, I put it in the active, in the black active. So now in this channel, I have a cannula potential that I will reference to a surface electrode nearby, and this is a surface electrode. I'm putting it on a neutral area. So if I put this here, like so, now on channel 2, I have the cannula of the concentric electrode that is referenced to the surface electrode. Of course, channel 1 core to cannula, like I said. So now what we're going to do is we're going to get out of the PowerPoint presentation to go and look at the program right here of the macro program. And this is a macro program here that you will see, and I'll show you in a minute how it runs. Basically, it will show you 2 channels, and I will ask the subject, once I put the needle in, to activate the muscle. Once he activates the muscle, I will look for a motor unit. Once I find a nice motor unit, I start triggering on it. This is where the trigger is in this machine. I will start triggering on it, and then I will see the concentric triggering a macro in channel 2. So the first thing that we're going to do here is we're going to insert the needle electrode, and we're going to, of course, put some alcohol to make sure everything is clean, and take the needle electrode here, untangle it a little bit. Here we go. And we're going to stick it in the muscle. This 1, 2, 3, here we go. It's inside the muscle now. That's it. And the first thing I want to verify is that I am in the muscle and I can see activation. So I am in the muscle. Just give me a little bit of activity. Excellent. Very good. So now I see this potential. So here's the sweep speed. I just changed the sweep speed, and now I'm gonna do this here. And so this is a nice concentric potential. So now and this is the macro channel, and now I'm gonna start to average. Now relax. Now you see this is the concentric channel right here, and this is the macro channel. And it's very nice and very easy. The concentric channel here shows you the concentric motor unit action potential, and this is the macro channel. And you notice that the concentric has a sensitivity of 200 microvolt. So this is about 200, 200, 400, so 350 here, and another 50. So it's about 400 microvolt for the concentric. maybe a little more, 400 or 500 microvolt. For the macro, and that's the normal macro, by the way. For the macro, it has the amplitude is 75, so this is half of 75, so it's 37.5, or 75 if you measure peak to peak. That's how fast we were able to get the macro potential. So now let's try another unit, and now we're all right. And now we can see the macro potential. It's really a very, very nice macro potential. And I put this here. And you can see in this case, there are two humps in the macro potential, which means that motor unit has two end plate potentials, two end plate areas, essentially. So now we're going to go back to the acquisition. And we're going to move this a little bit. And I want to show you something very interesting here. You see, we are still in the same motor unit, just to show you that when you are in the same motor unit, the macro potential still looks the same. Even though the shape of the concentric motor unit has changed, but the macro potential still exactly look the same. Look, this macro potential almost exactly looks the same. I'm a bit closer to it here, obviously. But even though the concentric looks different, the macro still looks the same. So I need to get away from this area to record another unit, or even better, actually have him activate the muscle more. So now when I have more activity in the muscle, I'm going to choose another unit. Okay, I'm going to try to trigger on the downgoing. Let's change the sensitivity here. Relax, relax. I'm looking for another unit now. And this is another unit. And the interesting thing here, I'm going to change the sensitivity a little bit. You can see the concentric is quite small, but also the macro is quite small. So I'm going to make it here at 150. So this is another concentric unit and another macro. Oh, we just changed the sensitivity on that. So I'm going to put the sensitivity up. Here we go. So let's try another location right now to get another macro. So here a very nice other concentric, and see how we see the macro very nicely here. So these first two units were the same unit. The concentric looked the same, but the macro looked different. I'm sorry, the concentric looked different, but the macro looked the same. This is another unit. It's a small unit. This is a new unit here, and you saw what the concentric looked like, essentially. So now, here's another unit. Yet another unit. And see, it's taken me less than 10 seconds, 15 seconds to acquire these potentials. So it's pretty easy to do, and it's pretty easy to see. And here, all of these are small units. We don't see them very well. But if I change the sensitivity, I start seeing them. And this is how easy Macro-EMG is. Just find a concentric unit, trigger on it, and you will see the macro potential. Thank you very much.